Hi guys, my name is Daniela, and I come from an Italian cultural background. We're deeply rooted in traditions that emphasize family, food, and the community. In my family, especially on Sundays, dinners are a really cherished ritual, and that's where multiple generations come together and we all share meals and strengthen bonds, and we also value respect for our elders, the hard work that they did to come to this country, and the generosity that basically forms our identity. Now, how does the culture shape my worldwide view? So, my heritage has taught me to value relationships and prioritize empathy and care in interactions. These values influence how I connect with others. I always place emphasis on warmth, personal engagement, and genuine concern for their well being. In any type of setting I'm in, I approach people with a sense of community, collaboration, and I always strive to meet those meaningful connections. As far as communication styles, we always have a very expressive communication. We're always talking with our hands, but we always want to come off as approachable and compassionate with patients. And I'm always focusing on really clear explanations and active listening to ensure that the patients feel understood and supported. And as far as health beliefs and attitudes, we place really great trust in our family and community, especially when it comes to decision making. It also helps me respect the patient's cultural and family views and encourages me to involve loved ones in cares of plans when it's appropriate for patients. I also think family involvement in care is really important. So we always rely on a lot of family support, and I think in health that really matters. So again, I want to create a collaborative environment where families feel welcome and integrated into the healing process for the patient. And I know there's definitely barriers that have to be addressed. So, of course, observing how language and maybe social economic factors may hinder healthcare. I'm very mindful in creating, an inclusive space. It includes being with the patient with language differences and accommodating any type of diverse needs. A scenario I'd like to bring up, or an example, would be if I was treating a patient from a close knit family. I might encourage their family members to participate in therapy sessions. I think this is a really great way for emotional support. I also would like to prioritize clear explanations of exercises and health strategies, recognizing, of course, that the patients may need to seek reassurance from their family before fully committing to their treatment plan. I also think that learning about other cultures is very important, so I actively educate myself on beliefs and practices of diverse communities. This can be done through reading, workshops, and just daily conversations with other patients. But I'm always looking to improve, so I always plan to try to develop skills, even if it comes to like using interpreters or simply just simplifying medical terminology to patients. That way, it just avoids gaps, especially with patients from various backgrounds. And again, addressing implicit bias I think is really important. So regularly self-reflecting and training on other cultures will help me recognize and counteract biases. For example, if I'm working with a non-English speaking patient, I will ensure access to translation services to avoid miscommunication. I think that's a huge thing. Of course, when the patient doesn't speak English, what I'm speaking, I think it's definitely hard to translate. So I want to make sure that they are fully aware of what's going on, and again, to avoid that miscommunication. And I also connect patients with any community resources just to help advocate for affordable care options, because I know, especially nowadays, things are so expensive, and I think that's a really big issue that we're having in our health industries. But again, I definitely have that commitment to growth. I would always like to receive feedback from peers and patients. Even if it's like attending diversity focused seminars, I think that should be really stressed. And I'm always, want to be remained curious and open minded. My goal is always to treat every patient with dignity, respect, and an individualized approach that acknowledges their unique cultural needs. I also just want to talk a little bit more about some strategies too. Again, for implementing equitable care. So I feel that, again, educating myself is a really huge benefit. And I think a lot of PTs should consider doing that. I think seeking opportunities to connect even with colleagues or community members from diverse backgrounds, that can help give really good firsthand insights. I also think that, actively just listening and acknowledging the patient's concerns, I think that's one of the best things you can do. I think listening is very important because then it helps confirm my understanding of their needs, especially through like open-ended questions. I'll have a better understanding. Just like what I'm doing, like my OPQRSTU, that would be a really good way to help, maintain accuracy and also patient privacy. Again, I also feel I have to regularly self-reflect to evaluate my attitudes and my decisions. I also, again, I know I mentioned workshops, that I think workshops and trainings should honestly be mandatory. And something really important, I think, is approaching every patient more as an individual rather than relying on a stereotype, and tailoring care to their unique needs, because I think there's such an emphasis on always going off stereotypes nowadays, and I think that people need to be, participating in bias awareness things, again, like workshops and training or just self-reflecting. I also think that ensuring my workspace is accessible to individuals with physical disabilities. I've been in a lot of clinics where, sometimes the patient can't really even get in the door, and that kind of just hinders on their recovery process. So I definitely want to make sure not only am I providing care, but the facility I am is also dedicating to people's unique needs. Thank you.